While we work to contain the Ebola crisis in the United States, let's be clear that West Africa's Ebola crisis, their Ebola outbreak, is one of the deadliest challenges of modern times, and we must be vigilant in supporting the efforts to solve this crisis globally. We are proposing a 3-point plan. If you remember nothing else that I say, remember these 3 points. Number 1, infection control protocols and worker preparedness are needed in all health facilities. That includes hospitals and public health facilities and public health clinics. Number 2, we think that these dedicated facilities are a good idea. We think that they should be in every state as well. But there needs to be dedicated teams of willing staff to be trained to care for patients suspected of having Ebola. And number 3, frontline providers who are key to containing Ebola must have a voice and be involved in the development and implementation of plans. All nurses and healthcare professionals have to have training that is recent and appropriate, not training from 10 years ago, training that is up to the new standards and the new protocols.
We do need those clear CDC guidelines so that we can perform our jobs in a safe way. We know how to take care of patients. We need the additional training. We need that equipment to be universally available.
There is a great importance to have some uniform, clear, concise protocols and procedures in place.
If we're going to solve the outbreak here at home, we must put our attention on Africa, because we knew that there was a crisis in Africa, but we didn't do enough. The world didn't do enough, because that was over there and not here. Well, this is a global society, and, we are everywhere now. And so it is critical that we do not, at this time where we're working very hard to make sure our systems are safe and we have the right protections, information, and so on, that we must also pay great attention to making sure that there's adequate funding sent to Africa